Hit the go on button. And you should see what's on that screen up there. Right there. Okay?
Okay.
Are you ready? Go, Joe. See, let me put something, go on button. Let's see something on video, see what's on that screen up there.
Okay.
She's still opening the meeting out here, yeah. Okay. Yeah, Vanessa first.
Yes.
Yeah, I'll go ahead and hit her and then make her host or whatever. Same. Okay, I found it, the smoking gun. You know, wait. That never happens. That's the clue.
Drive a while and get wrecked, and then they get shut down. Everybody will
Right.
I'm like, what can happen now?
How seriously do they want
Tiffany, can you hear us?
I'm sorry, I can hear you now.
Sorry about that right now.
I was like, telling you that option.
And
Yeah.
Tiffany,
Sorry, gentle.
Tiffany,
Yes.
two things. We have to do the oath. And
Huh?
we have to do the oath for your, the oath to be on the board.
Okay,
And all you have to say is I do.
okay.
Okay. Second of all, we're live on YouTube right now.
Oh, okay.
I'm not letting anybody in, I don't need that up, right?
And how you admit people, that's up to you. Doesn't have anything to do with the YouTube part. Whatever's on this screen goes in on YouTube.
Oh, okay, so I don't have to admit anybody that's. Oh,
You don't
okay.
have to admit any people because there ain't nobody to admit.
Okay, got it. That's awesome. And it records the YouTube too? For us?
We're on YouTube, people can watch it later. Wherever.
Oh, okay. Awesome. That's pretty cool. But we are being recorded now? Yeah.
Ah. And, board members, or everybody, this is Tiffany Payton. Tiffany,
Hello, how are you all?
you met Mark, Vanessa, and me. This is
Yeah.
Tiffany.
Nice to meet you.
Laura. Laura and Lauren, so we're on. And then this is Santosh.
Nice to meet you.
We have Sonia and Paige visiting.
Good to see you.
All right. 3 minutes. Okay. Yeah.
Thank you very much for your work. Thank you. Thank you for all of that. They look pretty good.
Yeah. The Ryan can report on me. Yeah, like you can log in. Thank you. Takes a little. Oh, she's not too high.
So I'll say. What's the best way to bring it spell?
No, you don't. Oh, yeah. No. All you have to post, all you have to do is post the ads. KBS does it.
First year.
Right, I know. Subscribe or whatever.
Yeah.
And the algorithm like working right now. One time people connect things in social work into so schools and social work, and so we need them, stuff like that, more kind of, you know, hope
Safety, but
since I try to
so
Mark is make the kids. All right, I'll guarantee you on that. Algorithm.
Your nephew probably knows more about YouTube than I do.
So, okay, welcome everyone. We'll get started. And we'll want to welcome our newest board member, Anthony Payton. Yay! Tell us a little bit about yourself, Payton.
So I am a nurse manager at Baptist Health here in Odom County. I run ACC outpatient unit, ICU, and med-surg. So I know you wonder, like, why did I get on here? I wanted to be on a nursing board, so maybe this will kind of eventually lead to that. So this is kind of you all are similar to us, just in a different way. So I have been a nurse for 18 years, a mother of two, and so I think this will be very interesting. And we do get to deal with social workers, of course, on our unit, and you all just do a fabulous job. So we'll see what goes.
Right this way. Raise your right hand.
Okay.
Tiffany, you raise your right hand. I do solemnly swear that I will support the Constitution of the United States and the Constitution of this Commonwealth, and be faithful and true to the Commonwealth of Kentucky so long as I continue a citizen thereof. And I will faithfully execute, to the best of my ability, the office of member of the Kentucky Board of Social Work according to law. And I do solemnly swear that since the adoption of the present Constitution, I, being a citizen of this state, have not fought a duel with deadly weapons within the state, nor out of it. Nor have I sent or accepted a challenge to fight a duel with deadly weapons. Nor have I acted as a second in carrying the challenge, nor aided or assisted any person thus offending, so help me God.
I do.
Right. I just like that. I just really like that. Anyway, thank you very much. Thank you for joining and taking your risk to be with us instead of this nursing board. So we're glad to have you. Minutes, Ms. Guffey.
Yes, everyone had received the minutes from December 11th, 2023. Motion to approve the minutes.
Second. Okay. Motion second. Any comments, discussions, changes? Approved?
Aye.
Any opposed? All right. Operations report, Mr. Kelly.
Okay, for December 2023, we have LSW 1 for applications, CSW 41, LCSW 29, 10 permits for renewals, LSW 2, CSW 25, LCSW 45, temporary permits, 4 were clinical, 0 were non-clinical. There were 71 contracts. 71 were approved and 5 were deferred.
They were deferred for, page 3, section D. Um, listing percentages instead of hours. So that always kicks the contract back, so just be aware that, I don't know why people want to put a percentage in there, but it's hours every time. So, CEUs, 2 providers were approved and 1 sponsorship.
Questions? Motion to approve. Motion second, all in favor?
Aye.
Any opposed? Thank you, Mr. Kelly. Finance Committee.
All right, so, our, December revenue was $34,021.38. Our revenue year to date is $247,769.02. Our expenditures for December, $28,220.55. Our expenditures year to date, $190,369.18. So it looks like our rate of, using our allotment is right on track. We've spent about 50% of our allotment for the fiscal year, and we're at 50% here. So that does not take into account some additional, charges that we are kind of expecting, like we're adding a 10th to the fund training start tomorrow to help with some projects we have, and some additional, expenditures around technology we're expecting. So I think, you all have requested additional, revenue for this budget cycle, and Vanessa told me they're not approving that yet. They're gonna ask us to wait until third quarter to get that, but that should not be a problem. Our current cash balance is $659,379.23. Some good news, for the 24-25 budget, we asked for $80,000 more than our current appropriation because it always runs short. They did not approve the full $80,000, but did add an additional $49,000. So this is going to the legislature. It's not approved, it's not finalized yet, but it's looking like our budget for 24-25 is going to be $433,500. And more good news, it looks like the 25-26 fiscal year, they're going to add additional money. And so far, the expected budget for that year would be $444,900, which would be an additional, I guess, another about $20,000. So we're looking at some increases in our budget, at least what's being proposed for the next 2 cycles. That's good.
Good job.
Thank you all for your work on that. Is that everything, the most important parts of that budget?
This is Mark as board counsel. I just want to clarify that when you talk about an increase in the budget that you are seeking and have been granted, that is the budget folks saying you are being allowed to spend more of the money you already have.
Correct.
There's no increase in fees.
No.
And no general fund dollars, no tax dollars. These are all, you're all talking about, you're talking about all of the fees that come from social
Right.
workers.
We're talking about drawing money out of our cash balance and then also relying on the revenues that we are.
Very good.
Thank you.
Okay. And then we also need to vote on the per diem for per diem and travel for today's meeting.
So did you motion?
I'll make a
Bruce.
motion. Okay.
Second. All in favor?
Aye.
Okay. All right, so we have several to present today. So I'll start with case number 2316-2316. That involves to do a relationship breach of confidentiality, basically a financial benefit from a dual relationship with a patient. In this instance, the therapist have benefited financially by referring the patient to another agency. So complaint committee moves to file a notice of administrative hearing and order settlement authority is given to work council. Mark P. over here. 1360. Motion from committee of more than one, so does need a second. Any questions?
So just to clarify, the therapist referred the client to
Client.
another person.
Yes, so the therapist had referred multiple clients to another agency where therapists would receive a kickback,
For the referrals.
ongoing kickback, like a pyramid type business, and had received financial benefit as well as a promotion related to the referrals.
A promotion and financial.
Correct. Related to, not directly from one, but related to the. Opposed? All right, case number 233623-36, which are from confidentiality. The committee recommends dismissal with insufficient evidence to support the initiating complaint. Questions? Favor? Aye. Opposed? The next one we have is case number 2367, the complaint involves dual relationship or boundary violation. The committee in this case also recommends dismissal with insufficient evidence to support the initiating complaint for case number 2067. 3-67. Questions? Favor? Aye. Opposed? Case number 2368-23-68 involves client abandonment. It involves a therapist who failed to maintain contact with the client for a significant period of time, resulting in the client making the complaint. We did, however, receive a response from the client basically saying that everything was fine. However, the board reviewed the complaint and recommends assurance of voluntary compliance because the client abandonment had happened regardless of what the response from the person that complained now. So basically, somebody made a complaint and had reached out to the board saying, even though these things happen, I no longer want to move forward with the complaint. Or cannot, just dismiss the complaint. So assurance of voluntary compliance. Questions? All in favor? Aye. Opposed? Case number 2369-23-69, it involved a failure to report suspected child abuse. The report was made by a colleague of the same agency. After reviewing the complaint, the board determines that the person did not have a duty to report. So the recommendation is dismissal with insufficient evidence to support the innocent complaint. As you know, the DCBS mandate, you have to have reasonable belief that a child is in danger or harm. So we didn't see any reason for anyone to make a report based on what was in the petition.
But a coworker did make.
Felt differently, yes. A coworker felt differently than the coworker felt that the person should have made a report.
Okay, and they're the ones who filed the complaint.
Yes, we reviewed it and we didn't feel that there was any reason to make a report.
Okay.
And I believe the report was ultimately made by a different person, I believe was denied by DCBS, but we didn't feel there was enough reason mandating the person to make a report. And these are all typically up to interpretation of the person receiving the information. So this is all in favor?
Aye.
Opposed? So there, the last one we had is case number 2370-23-70. It mentioned some references to the harm to a patient and a client after reviewing its anonymous report that we received. there is insufficient evidence to support the incident complaint boards cannot move forward with a solid investigation and inquiry. Serious allegation, but we have no information to follow up. Yeah, so we can do it. Yeah, and when we dismiss this, we do based on the information we have on hand at the time. The person who made the complaint can always resubmit a complaint after they have more information or they're provided. And he may choose to go a different way at the time if we have more information. And we have taken those anonymous reports in the past when we have a interaction, we go to it. We can do that, but we don't have anything. So basically, if I want to reference Mark here, but he clarifies, he also, perhaps like somebody did call 911, said there's a robbery at a bank. I have no clue which bank, where, whatnot. So
I just heard.
You
I
heard
just
that?
heard, I just heard.
Yeah, so
So it didn't say like what?
nothing. Right, nothing. No phone number, no address.
No
So we,
bank.
no email, no bank. So we are.
Where to go?
Recommending dismissal. Insufficient evidence. All in favor? Aye. All opposed. Okay, Mr. Brinkman, you have a comment or situation case for the board?
Yes, this is Mark Brinkman as board counsel for those of you online. We have case number 2022-055. 2022-055 is set for a one-day administrative hearing regarding alleged non-compliance with a prior settlement agreement of the board. And the hearing officer set a date for Thursday, February 15th at 10 a.m. here at the board offices. And I'm looking for volunteers to serve, to have their very own jury duty of the board to sit with the hearing officer, hear the evidence, and make a recommended decision to the full board. The hearing officer will give further instructions about that process. The hearing officer will write up your recommendation. So you need to work together to inform them of what conclusion you reached and why, and to edit it, and that's part of the process. And then the full board will either accept or reject or modify the agreement. So you can delegate this all to the hearing officer to do that work for you and take a recommended order. You can have one or more board members who are not on the complaint committee to do that. Or you could have all 4 or 5 members of the board who are not on the complaint committee do it, and then they would be making the one and only decision of the board. And it wouldn't go to the full board because you are the full board.
So what's the board council's preference?
I have no preference, although I'm always proud of the boards that I work with. For Ms. Payton, the new board member, including practicing before the Board of Nursing,
Yes.
where 2 members sit with the hearing officer. So you're litigating a case about a nurse in front of nurses. So they typically know one way or the other. They make very good jurors in Board of Nursing cases if they're a nurse. So in any event, you have 3 choices and I don't have a preference.
I guess it goes down to volunteers.
Because we can't, we're on the committee, so. Lori?
I volunteered.
Okay.
There's one. Also, the case still should settle and could settle, and we'll know that in advance. It would be a waste if you had to drive down here and we settled on the courthouse steps, so to speak, because that's just awful late in the process to be. You haven't really saved very much if that's as late in the game as you settle it. But, you might know the day before or a week before if that day is free up. Are there any other volunteers? It's supposed to be scheduled for a whole day. And I wouldn't want to have anyone have a limitation like, oh, I have to be back in Lexington because I have a doctor's appointment at 3:30, because you just never know.
Right.
And part of it is how quickly you make a decision. If it's 2 board members, then they make a decision together. And when the hearing officer writes up your decision, that is not on the spot. While they're with you in closed session, you can have as long a discussion as you want so that you're both on the same page. But I wouldn't want you to say I have to be back in Northern Kentucky at 3:30 because it may take you a long time to explain to the hearing officer. And the hearing officer writes up something for you later. It's not all done on the same spot.
So just to clarify my own understanding of the procedure, so whoever, 1 person, 2 person, or full board excluding the committee, They're representing on behalf of the board, right?
Yes, they're hearing the case, but they make a recommendation to the rest of the board members who couldn't be there that afternoon.
Okay.
That's, or the hearing officer hears the case and makes a recommendation to the board, yay, nay, or up or down, or left or right. So we have one volunteer as a board member. I welcome any other takers. If not, then Laura is the jury of the day.
Yeah. All right, Ms. Pate, any interest?
Heck, might as well throw me up in there. I'll
Okay, thank you.
All right.
But the idea is, it'd be great if we could have two, because it's hard for one person to, you know,
I'll check.
so if you can check.
I'll
I know, but if like this company, that's great, that's two, then y'all can write up something, bring it to next.
Also, if you have two board members, then I usually try to get the parties to agree or the hearing officer to order that in the unlikely event of a tie, that the hearing officer would be the tie-breaking vote, because you can delegate the whole thing to the hearing officer and make the vote for himself anyway. So I have a deadline of Friday to let the hearing officer know. So if anyone else changes their mind or needs to check their schedule, just let me know today.
Tiffany, did you get the date and time?
No, what is the date and time?
Thursday, February 15th at 10 o'clock in the morning at the offices in Frankfurt here at the board.
Right now.
You prepared to be here until end of business? Yeah, or later. Or later. We go late, so like Mark said, don't plan on being back on any particular schedule, so.
Okay, I think, yeah, that day I'm good with meetings and stuff, so I can come February the 15th at 10:30, yes.
Wonderful.
10 o'clock.
10 o'clock.
10 o'clock.
I'm sorry. Yes, 10 o'clock. I can be there for this one, yes.
Wonderful, thank you.
Thank you.
Thank you. Okay, yeah, that's all for the Mike committee. I'm clear on that. All right, applications.
Okay, we have two applications today. Applicant one, we reviewed back in December and have requested some additional information that we have received, and we are okay with applicant one going forward with taking.
Questions? It's a recommendation from committee of two, so no second needed. Questions from the committee? Favor? Opposed?
Okay, and then applicant number two, I think we still need some additional information and maybe need to defer to next month. It was a question related to the level of exam that they were requesting based on their degree that they've obtained. Meaning they've received a master's degree and they're requesting a licensed social work they're coming from another state, so there may be a question of like maybe having, actually, I don't think that they had a social work license. In the other state, they had it was so it would be taking the exam at that time, but we just want to clarify they're requesting the right exam and then also some additional information that we have to stuff on our application.
So you recommend referral on
Yes,
this?
yes.
Okay.
So they're technically qualified for CSW, they're asking to take the LSW.
Uh-huh.
You want to clarify to make sure.
Yes, yes,
Because other states, LSW means.
Means something different.
yes,
Yeah,
yes.
yeah, yeah.
And we needed a little bit more information about a criminal.
Yes.
There's nothing to do.
So,
Yes, that's it.
oh, wow, thank you. Good. All right, operations committee, committee one and staff right now. Staff have completed, the write-ups and, show working on the last sections of the operations manual. And the write-up for like some of the processes for, fund committee and onboarding for new members. So we'll be moving on to the next pieces and hopefully all that's done, because it's no point just doing one piece at a time with you guys. That's bring all the whole chapter at Appreciate their hard work on that. Old business, ASWB updates, anything specific, I didn't hear anything from ASWB that was earth shattering or whatever that we need to know. I don't know if anybody else.
I did put out an announcement, I haven't gone and looked at it, but did they release the data from their listening sessions yet? They said they were going to.
They said they were going to, but I haven't seen that part. They maybe some chatter about the education committee to pay. I don't know.
Well, we should look for that release of that information, because it was those, like, had targeted focus groups relating to exam experiences and, so.
The other thing was about the social work census that they're going to try to launch. I think it's still March. Do you see anything different on that? That was all.
That and the transitioning still with,
Here's the
Yes, on.
of the testing.
When we have that transition method, the new system is already in place, right?
They already have it.
They already have, they designated transition.
Apparently been some issues with the crossover from Pearson to PSI. They actually, I guess the last 2 weeks of December, they didn't take any applications at all.
So just to clarify for the listeners here, so they are, PSI is the exam
Test.
Test.
For vendor.
vendor moving forward, okay?
Yes.
Okay, social work compact, we have a bill number, HB 56. Finally, co-sponsored by, Representative Fleming and Representative Wilner. We are so happy that that finally made it to the bill status, and, so you can follow that. There are now 15 states with legislation initiated. I viewed the website with Council of State Governments earlier, middle of last week. Missouri is still the only state who has enacted or passed the legislation. The newer states are like Utah and, I think Nebraska. Looks like Wisconsin and Ohio are right on the verge of getting it passed. Indiana is the other. Indiana has initiated. So we still have Pennsylvania, New Jersey, New Hampshire, Vermont, North Carolina, South Carolina, Georgia, Alabama. Is it Alabama? So there's like 15 total. Not counting Missouri, it's 15 others. So it really does look like that, you know, all goes well in our session, probably everything would be passed. Also, the time bills get passed through.
So do you know if this compact include other jurisdictions like Canada, Guam?
It might include Guam because it's a U.S. territory.
Not
Not
Canada,
Canada. Canada would have to do their own compact.
even though they're part of the SWB.
Right, I don't think the U.S. law allows that.
I have a question about, I know they said the first set of states to pass would be the ones that really set the rules. What if more than 7 happen?
More than seven, that anytime you pass, once the legislature passes, it becomes law in that state, and that state's entitled to a federal petition.
So, but there will be only 7. So
No,
we're,
no,
No, no,
Oh, no,
anyone
no.
seven, you could have four.
Yeah, right.
Okay.
Oh, yeah, no, there's, the structure is, I think, 11 states.
okay,
And like ASWB, I mean, ASWB has represented, and ASW has, there's other representatives on the total commission. So there should be 11 states eventually on the commission itself. But it takes 11 states to activate.
to activate. I just wondered if we were at number 9, does that mean we don't get a seat at the table to help
We,
write?
we will always have a seat at the table, but not necessarily on the commission.
Gotcha.
So we're waiting on it to be assigned to a committee.
Correct. That could happen probably today or tomorrow.
Hopefully it does.
It has to go through committee on committees first. So if you want to do bill watch, put that on the list.
Will Fleming testify, or will they ask her to testify?
It's he gets assigned to the committee, that's when we'll probably. So, you can always reach out to them, I'm sure, find out the stats, and but Milwaukee is a quick way to.
Mr. Chair, as board counsel, I just want to kindly point out, and I'm sure you all know, that Dr. Lisa Wilner is a licensed psychologist herself and representative of the House. And I believe psychology did pass its own compact law in Kentucky. They're one of the boards. So well, nursing has.
Yeah,
one,
well,
though.
very, but I was talking more about behavioral health.
Yeah, in mental health, psychology was first. I think physical therapy has one.
Yes,
She would be well qualified to advocate for the legislation, being a mental health professional herself and in a profession that also has its own compact. I know very little about the compact process and the law, but I'll learn.
I think there's 34 psychopath, what they call psychology. I think there's 34, 36.
Well, if SIPAC as a compact licensure law has that many people, that has grown really quickly. Like in what, 5 to 7 years, it's now the majority of the US jurisdictions. That's impressive. They must be doing something right. Everyone's on board. 34 out of 50.
It's a long time coming for us.
Thank you.
Okay, 16 out of 50 states for social work already. Yeah, right. One's passed and that's 15 others coming up, so. Florida's the other, Florida's the other. Not Central State. That's okay. That's all right.
So when you're licensed in one, you can practice in all of those once it would be activated?
Right. You don't have to get a license over there, nor do CEUs, or you just do it in your state.
Okay.
As long as your state is one of the member.
As long as your state has to be a member.
I think all of my states have been licensed. They're in the.
We're all, Ohio, Indiana, Kentucky. Your
Yeah.
best state is in
Yeah.
And from what I've learned.
Yeah.
Just to get the 35,000 foot view, of what a compact, the best example is, your driver's license is subject to a 50-state compact. Because you can take your US driver's license and drive in Indiana or Illinois or Tennessee, you know, and if you get a speeding ticket in Illinois and you don't pay it, it will eventually follow you to Kentucky. You could be in trouble. But if you move your domicile to Illinois, you have to get an Illinois license plate. But that's an example of a compact that
which
your Kentucky driver's license is recognized and you can drive in California.
similar to if you move on the compact, then you have to keep a declared home state.
Yes.
It's a little tricky. You'll have fun with the law part of that.
Well, likewise, if you work for the Veterans Administration,
Well,
you don't have to have a license in the state where you're physically located. You can have a license anywhere.
well, for VA, see, they're kind of a carve out,
Sure.
because they're kind of a separate entity. They are privileged.
Yes,
He has a license in Kentucky, practice all over the world, VA.
correct.
We
So as
can't,
long as you
even with
have-
the compact.
Right.
Yeah. Oh, yeah.
So we have a different breed.
Oh, yeah.
The nuance of that though is that you can only practice within the VA system. and
Correct,
you can
Correct, yeah,
actually-
you cannot practice anywhere else.
Right, you can't.
Unless,
so-
Absolutely. And the people that sometimes don't understand, like, oh, I want to do a little private practice on the side on Saturday. That's not.
you cannot,
Can do.
you cannot treat a veteran as a private practice.
Right.
It has to be within.
I just wanted to
Oh,
clarify
yeah.
that. There any
So
confusion out there?
the federal government is like a different country. And the states can't tell them what to do. And when I gave an example about that to a licensure board about Fort Campbell, I said, you try to get past the guard's desk with the tank and the machine gun, and see how far your authority goes past the guard's desk with the tank.
Exactly. Exactly.
Thank you.
Thank you. Yeah. So, good. Some IT updates. The website is ready for us to proofread. So we'll be assigning you some pages maybe to proofread for accuracy and editing, in other words, grammar, misspelling, et cetera, but accuracy of the information that's there. Flag it or whatever. So send you a page link and just have that page. Go through it and make sure everything there is right. You don't have to worry about, you can look at everything you want to, it's just your page is that page. No, 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 I have one or two pages. So, and mainly it's the pages called the FAQs, the frequently asked questions. Make sure those, the rest of it, you pretty much think it's ready. One of the things that you, that I didn't get to show you the last time when I saw the test site, that was missing, and I didn't notice it until we were doing the testing, doing the display. Under the board information, there's the minutes, there'll be the newsletter, there'll also be a section for all the disciplinary actions that go public. So that anybody can link into there, find disciplinary actions. It'll still be connected on their license page for you to follow license verification, but it will be also. Conference room, we are not in the conference room yet. We are, these two kind of go together. We have a lot, we're on live YouTube now. So you can search your YouTube for that KBSW, and that's our channel. And that'll be the link where we link from Zoom directly to YouTube, so people can watch me, you know, and it's a secure link in the sense that we hope that everybody will hack it, but you know, it's perfect. So that's happening today. And hopefully we have the equipment for the conference room. We decided not to overtax our ability to implement new technology and systems. So we only doing this part. Next time we come, hopefully Mark and Vanessa will have time to test the new microphones and camera system for the conference room. The TV is installed in there, so we'll have that. All right, questions on that? It seems like a huge piece of what we're doing with that, so people can view it, participate. They can look at the meeting later. In other words, if they want to go back to the YouTube and see it later, because they couldn't do it during the time, they can have to decide. We're not required to keep it there for any particular period of time. We can decide how long we keep that. All right, Mr. Kelly, you have a proposal about application software.
Yeah, we have, been Tyler Technology has put together, a demo for us to look at, and it would be totally restructuring our back office with, new technology program. And it's sorely needed. It would be very convenient for us, to be able to adopt that new technology, update it. As I mean, the back office is great, but, as we get in more applicants, we are taxing that system. So we need to update. So we want to do a demo for the board.
Has a healthy price tag, you might guess. We have to, but especially because if the compact bill goes through, we're gonna have to handle those things. Our license, it's taxing, and if you recall, last summer, we had an issue with the system not working well, and the staff was having to print things off and double check. We had people got their license extended for 10 years and stuff like that, that we had to go back and correct. So, our software is right at probably the life cycle end of it, and so we're going to have to do something.
And one of the things that has been mildly concerning for me personally is how, if you have a license number and last word for social, you can access pretty much anybody's, portal. I think we should have a little bit more than just knowing someone's, basically, if I know someone's last word social security, I can access their license number. Anyway, I think we could go and make change it. You could. So I don't, no, I don't think that, like other boards, you actually have username and password that you select.
And I'm guessing this new system would have a
Yeah,
bit more
maybe
security.
looking into, I don't think that's highly secure.
No, so we need to, that's why we need to change software and update the system so that.
Yeah.
Now, is this a company it DOT recommended, or how did we?
Well, it is our.
Oh, we
Our
did.
technology is our seal.
Okay.
The Tyler,
Okay.
they are the same ones that do our website.
Okay,
Do our technology. So we feel comfortable with that. I went through the demo with Mark, it's good. So we need to set a time. How long do you think the demo would be? Probably like 30, 45 minutes. So it would take a little time. Because and you know, I'm not saying this in a bad way, it's just that part of it, you have to remember they're trying to sell us. So you get the sales pitch part of it, that's what makes the extension. That's okay. I just want you to listen to it and see let Mark, that's to show you how it will help them in their work. And given the fact that we've got a really nice financial report, I think we can afford it.
Yes.
So,
Have you had a chance to review that yet yourself?
I have. Yeah, I looked at price, but I can't remember what, there was, an overall fee, initial fee, and then there was a yearly cost.
So you don't know what the software looks like yet?
yes,
yourself?
oh, yeah.
Oh, yes.
How do you find it helpful?
Oh, yeah.
I think that's more important is, you know, people who are maintaining that record and using it, you find more helpful if we provide our input. So you have a better understanding.
Because we're in it every day all
Well,
the
we
time.
need to do something.
Yes.
If we didn't do this,
Yeah.
what would the other option be? Find some other.
We find some, have to find some other company, and they came up and offered it to us. And they have always been straight with us as far as what it is. You know, it wasn't too salesy, you know, but demonstrating the technologies of the software companies
So this is an update from what they,
currently do.
so they're already the people that we use. This is just updating the,
Their product already.
I've been referring to it as the back office deluxe.
Yeah, or back office on steroids. It's a huge change from, it's a huge leap. This software dates back to, when did they tell us? 2011 or something? So we're, yeah,
Well, and they have intimate understanding
of
of
our
what we're using it for. They also have intimate understanding of what went wrong with it over the summer.
right.
Because, you know, they had to repair it.
They had to fix it.
So basically, they came to us and said, look,
Look, y'all,
you want to fix this forever?
you need to.
Like, here's what you need,
Here's what you need.
because you guys are growing.
And other boards use the software already.
Yes, yes. Arkansas is using it. A bunch of other places, all your places using Arkansas.
I've been in Kentucky
Oh,
or other boards.
They don't have anybody. in Kentucky.
They don't have anybody to
They
do
do
it
it first.
This is the first in Kentucky.
But
I think it's, which board was it? I don't remember which board they said was looking at. Bill Images? Medical imaging.
I think
That's what it is. Medical imaging.
so it's, I mean, I'm real excited about it. I think it like
And
make things so much easier for me. That's
it really is, so. But I don't want you to take our word, but I'd like to do the demo so you can see it yourself before making a decision. Talk about the specifics. The initial fee is high, it's 55,000. But it's a one-time fee, then there's a maintenance fee, and I think that's good too, because software, anything that, I'm sure all of you have free apps on your phone, okay? Anything free is free for a reason. And it's also not good for the most part. And if you want good stuff, you have to pay for it. And these are reputable folks. So anyway, if we want to, we'll look at doing the demo, maybe at next meeting. We'll look at the time about to.
So looks like we're using TurboTax 1010 easy, right? When all, yeah, they can pay.
And we also just need the number on, not just the initial fee, but not just how much it is per month, but how much it is per month over what we're already paying. Because we're already paying something.
Yeah, we're already paying something, and then in addition to that, you know, paying for all of the repairs.
Right. So that might be some good data to bring to the thinking with us, is here's how much we put out in repairs this past year, here's how much our monthly, or, you know, you can add up to monthly, I think it's this one, isn't it, the other COT charge, you know, how much we spent on that, and then here's how much it costs a month. We wouldn't have repairs, I wouldn't think, on the main program, right? And if it's, you know, why are you laughing?
Well, and then,
Well,
you know, we had a bot come into our complaints and was filing complaints. Yeah. That were, yeah. Jimmy Hoffa.
Hey, Victor,
Yeah.
hey, Victor Bonhoeffer, hey, Victor Bonhoeffer. Now, keep in mind, me not knowing who it was, I really thought it was it.
Jimmy
I don't know, after they told me, how would I know?
Jimmy Hoffa.
It'll be hard to find him.
They were working at State Farm and UPS.
Yeah.
He was the client.
No, I really thought he was a social worker who works at State Farm. Yeah. What do I know?
So we need something that's off. And, but boy, we got a lot of complaints.
Yeah, yeah. We got that a-
Well, you remember though, Kanye did, file for unemployment through the state of Kentucky, and they thought that was a joke. And it turned out he really wasn't working. He was really a Kentucky person.
But not big fun.
No, not that.
Okay.
But they like laughed at it at first, and then they found out, oh, it really is a real person.
Well,
At least they were on top of it.
Yeah. Okay, regulations, Mark and I will be going back to the, subcommittee section on our temporary rate, which is 160, and our telehealth rate 170. We deferred at the, December meeting for the discussions. And so we're going back on that. Of course, one of the next regs that we are taking a long-term approach at is the code of ethical conduct.
well, it's ready to launch. The Qualtrics survey is all approved and ready to go. And Mark has that and some language to send out in the email. The only, what we're waiting on now is for us to do a final kind of cleanup of our, email list. And as I understand, the new employee, temporary employee will start tomorrow, and Mark said that person will be put on that task, to kind of spot check for missing, emails, and maybe make some phone calls to folks who have maybe a phone number but no email listed. And, my preference is, you know, like you told me, you think we have about 80% of our licensees we have an email for, which is still great. If we can add more to that, that's fantastic. For the sake of just getting the information out there, my preference is whatever we can do, you know, in the next few weeks, let's go with that. Even if we don't have 100% email, listings for every single employee, every single licensee that we launch, maybe by the end of January.
Any of those who don't have, if they requested a
Right,
link,
they
we
can
can always
link.
update that and send it to.
So that's no
We
big
can
deal.
go to the self-service portal and update it.
And we won't keep the link open indefinitely, because it's something we have to do, you know, data analysis and all that, so it'll probably be open maybe for 3 or 4 weeks. Would be the max, and then we will look at the data.
You said it's kind of like when that's updated, then we can, the next part of on the agenda is that then we have a mechanism for other kinds of communication. Because we have one of the, emails that in case we have to send an email to say, the CSW supervisor or just to LSW or something like that, we can break that out.
The new technology would be very helpful.
Yeah. Yes. Yeah, thank you, Marcus. Yeah, the new technology will help us. Bring on Mr. Kelly. I think y'all worked on the statement.
It's not written.
Okay. Leave a comment that we will make about the Medicaid grant from Behavioral Health Association.
Yes, I did draft something for Mr. Kelly and welcome him to complete it from here, or if he wants me.
We remember last meeting, we delegated to them to come up with one, so we have until the end of the month, the time period, any board member, anybody can make a comment, so you don't have to wait for, so to speak, official statements from the board. That's coming. Next.
where are we gonna have the 2024 retreat, cause Lori, guess what? Kentucky Dam Village has been booked for a year.
Oh, wow.
Oh, yeah.
What if we try Barclay or?
Oh, they all have.
What in the world are they doing?
Yeah.
Oh, because of the,
Yeah,
Yeah,
because of the
so, we can't
well,
do that.
we could have the retreat at our campus, we could do the campus hotel room.
You know,
We
That's
built
the-
a hotel room.
that's, we can't get hotel rooms, everything's booked up.
Seriously?
Yes, and the fee is now up to about $340 last one I checked.
I hear Northern Kentucky's great at
I
that.
heard that too. I heard that, maybe Northern Kentucky is down in August.
What, we had originally said we were gonna do the retreat in March.
Yeah, we had, and we moved it to April.
Yeah, we were just trying to do,
Yeah,
we were-
do the, so we can move it back to March if we want to, go back to Northern Kentucky and go up to the.
I'm just kidding.
I know, that's okay. We have to, we can't go.
I don't really wanna be gone during the eclipse, I wanna be home sick. Oh. I don't wanna go.
She doesn't want to be left in the dark.
Party hard.
this is why we were gonna change it back.
Oh, change it back to March, okay,
Yeah, let's
March,
do that.
and, Northern Kentucky,
Could we do, is it Kentucky Dam Village in March or not?
well, we could, but,
I literally was just kidding.
so, yeah, I don't know, we'd have to check on the room, but.
I do wonder if is there a safe market for them?
Butler's probably the closest.
General Butler. That's outside. We talked about that last time. But
Yeah, they were doing it.
May I still vote? They have the dining room and everything.
So you wanna check hotels for that then? Right, so.
So we do Northern Kentucky?
Anybody want to leave it to the staff to do, or you want to make a motion for one or the other?
Where are we going first of all?
Well,
Well,
that's the thing, is if-
And I vote for Western Kentucky, given that we have the longest review all the time.
Okay, then
Yeah.
I'll second.
Yeah.
So we have
let's
retreat
say
on
Kentucky
Sunday.
Dam Village is
and
first
meeting
option,
on
if it's
Monday,
full,
right?
then
We
we
can
move,
decide.
then we'll do that, we'll go to one.
I mean, I'm willing to do North Kentucky. I'm not trying to be difficult.
Oh, no, and I'm willing to do Western Kentucky too.
So let's go with the month, we're doing it March.
We're doing March, this first, is it, do you need a motion on that? We'll put it together with the location.
We just.
We'll do it in
Right,
March.
location.
We'll go to, we'll check Kentucky Dam Village. If it's not available, then we don't keep chairing. It's not, Kentucky Dam Village is not available, then let's go to, that's the offer. So somebody's gonna have, one of us is, you're gonna have travel, or we're gonna have travel
That's fine.
as an alternate.
March 11th, right?
So we would arrive wherever on Saturday.
On Saturday.
That's the first
Saturday,
week.
Monday, right? Sunday, Monday.
Yeah.
And if we're at the extreme, if we're either direction, we'll probably do the meeting part early in the morning.
Earlier in the
maybe
day.
Earlier than 9 o'clock, and then give people time to travel, do the committee meetings.
Is it possible for you guys to give us a heads up as soon as you find out? if There's any.
Yes, I put a proposal in to Kentucky Dam Village and the other two places up there in that
For
area.
March, yeah.
I did it for April, but I
But see, March
but I can
shouldn't
change
be-
it to March.
I don't think March will be an issue, because it's not that crowded in the wintertime, and it's, I mean, they have, the resort basically has rooms, it has, cabins, executive cabins have 3 or 4 bedrooms, they have a restaurant on site. There's lots of restaurants around.
If you're willing to room up, there, 2 beds in the room.
No,
There's
no, no,
room,
no.
maybe not that,
I'll
but
give them.
there's 3 bedrooms each, and those
So you
executive
want that,
cabins.
you want an individual room?
Yeah,
Yes.
I like you, but not that much.
I mean, well, I don't know, we could share cabins. Is there individual bedrooms?
Yeah, cabin's okay.
Cabin's
If they have individual room.
Sometimes you can get those executive cabins, like, 2 or 3 of them right together. And they
That's
have a
still
kitchen
separate room.
and a
That's
dining
still
room,
separate room.
but if not, they have meeting rooms in the lot, in the main lot. They have meeting, like, by the night, there's meeting rooms where we can meet, and it will be.
Yeah.
We do still want to talk.
Yeah.
Need a motion?
So maybe.
Second.
All in favor?
Aye.
Aye, thank you all. All right. New business. Have a special guest. Ms. Fairclough, you can introduce yourself.
Absolutely. I want to thank Mr. Cecil for having me here today. I greatly appreciate it. Over the past several months, I've had the pleasure, and I'm gonna start sitting if you want on talk, to get to know Brenda, and I have a great deal of appreciation for her unwavering enthusiasm for the field of social work and always looking to make it better. It's not just for the professionals, but also acknowledge Brenda's enthusiasm and partnership and camaraderie, and also getting to meet Mr. Cecil. I will give you a little update on the social work licensure compact. I work for Interact for Health. We're located in Greater Cincinnati. We are a private health foundation, and prior to this year, I've had a lot of emphasis working in the substance abuse mental health area for our 25 years history. 5 years ago, going on 6 now, we narrowed our focus to the opioid epidemic, and that's when I came on board. I worked for the state of Indiana for 15 years, native of Southern Ohio. Lived in Indiana for 30 years, and then did a school in boy, and all that stuff happens. I am a social worker. I have a bachelor's in social work, and I really feel the challenges that we have right now with licensing and certification, because even back during that period of time, I won't tell you what decade it was, after I finished my undergraduate and really did think I was going to go on and get my graduate degree, when I looked at the salaries, okay, let's believe these. When I looked at the salaries in the late 80s and what it was going to cost me to go to graduate school, I said, well, I'm just out of my mind if I do that. So for whatever reason, I started looking at policy. I was out of my mind still. My first job after a 4-year degree was less than $20,000 in 1989. And my first internship was lobbying for social work licensing in the state of Indiana. We didn't have it yet. So that's how far we've come just in, about 20 years. So it's important to me that we don't undo all that hard work it took for us to get to this place where we can be recognized as professionals. And so when I talk today, it really is about not quantity, but about quality. We know we need more, and we know that right pay is the age-old, sad story that we continue to sing. The quality within the profession is something that I would never suggest on the sacrifice. Being at Interact for Health as a foundation, I cannot lobby. I'm the mental health program director, policy director. I do a lot of advocacy work, so there's a fine line of, walking right up to that bill. But one of the things that we've been working on very intentionally with our new strategic plan is the mental health crisis that we've known has existed for a long time, right? It's always been a crisis, but it took a pandemic. I say it took a pandemic for us to realize that people working in behavioral health are important to the rest of the community, be it work, be it education, whatever you want to talk about. A strong behavioral health workforce is important to the community. And we learned we got to wash our hands. So there you go. 2 great things that came out of the pandemic. When we started looking at where we wanted to plant our feet in policy, because there were so many. And we had talked about what are the root challenges that we face. If we know that we have a mental health crisis, what are some of the root challenges that prevent those folks in crisis from getting the help that they need? And workforce and parity were the 2 things that rose to the top. I'm a social worker. I am not a Medicaid expert, but they seem to think that I should be. So I'm tackling workforce first as I learn more about parity. The social work licensing compact, we think, is a great first step in bringing access, not advocacy. I started saying not network advocacy, but network access, because what is adequate, right? We can't really answer that question, but we know people can access it. So the compact reciprocity are great opportunities to think about how we can widen our field in our access, consumer access, without necessarily changing the quality of the people that we're working with. With regard to the compacts, we did meet with a couple of gentlemen from the Council of State Legislators around the social work compact, because it is scheduled tomorrow for its final committee hearing and vote in Ohio. So we anticipate that will be the second state, Ohio will be the second state on board. And I'll be up there tomorrow for that committee testimony. Indiana feels very good. There's really nobody that's going to stand in the way of that compact. Last session they passed the counselors, this year counselors for marriage and family counselors, passed the counselors compact, so we feel good there. Was excited to see that Kentucky decided to introduce one. We hope that Kentucky is the third state to come on board, and in anticipation of that, I'm sorry that Brenda had to leave. Just last week, Brenda Burrell for Calipart in Indiana, a representative from Ohio, not from the association, but we're going to bring her on board. We all had a meeting just to talk about where we are and the workforce challenges from a policy perspective in the 3 states, and where do we have some alignment? What are some of the learnings that we've had? What can we maybe learn from going forward? And one of the things that came out of that conversation, so I don't know who would be appropriate here to bring on to the next conversation, is that if our 3 states are the next 3 to pass this compact, we have the potential to come together in some degree of unity and start working on the definitions for the profession, because that's one of the biggest challenges everybody talks about. We all define it differently, and not only do we define it differently, but Medicaid, HHS, everybody uses them differently. So we did have a great idea of what if we pass our compacts and we go into that 7-person compact. It takes 7 states to initiate a compact, kind of showing some unity. Maybe we could get the others to come on board with what we want to see here in our region. So whoever's appropriate for that, I think afterwards would be great to bring on board. They want to meet again, I believe on the 29th. And we're going to, I was going to break that in. So we're going to be looking at the data that Deloitte prepared for you and the Kentucky report from Deloitte. So they use, thank you so much. So we also have access to the data that Deloitte prepared from JobsEQ. And we're going to have our researcher kind of go over that a little bit more granularly with our small group. But I offer her to come to February. I let Mr. Cecil know that if you wanted to dive into that report and the data that Deloitte had presented from JobsEQ, we can do that for you at the show conference. She's with your bank? Yeah, she's with us. To kind of cipher through that and go through what some of that information means for you, if that would be helpful in any way at all. I'm happy to do that. What I shared with you is some revisions to the statute that, again, align with what Deloitte is recommending with regard to the application process. Capturing some additional geographic, and let me say, Ohio, Kentucky, Indiana, a lot of information in, not a lot of information out from the boards. Nobody, does it better than anybody else. And most of the information is not captured on the application, or it is voluntary. What we have found in all of the work that Ohio is working with Deloitte too, and Deloitte put out a health and human workforce report, completely different from what you have here, by the way, which I found to be very interesting, is that we talked a lot about needing to improve the workforce, and some of our states have invested millions of ARPA dollars into workforce, but we really don't know what our workforce looks like, right? I believe, I don't know, I give you my firstborn, even though she finally gave grandkids, that we have fewer clinicians doing patient care than what the data would suggest. Because they're in supervisory or management positions. And I can tell you, I know several clinicians and not a single one of them does patient care. They are all in supervisory or management positions, and the reason is because they have student loans to pay. So we know that pay is not something we can get around. We know that parity is not something that we can get around. We really have to tackle those head on. But what we do know is we really don't know what we don't know, or we really don't know what the field looks like. And we all know that we probably need more, but we don't know who we need and where we need them. And I have said that we need to have the right people in the right place doing the right job. Right? And that goes part of that to retention and workplace satisfaction. And do I have the support staff that I need in order for me to do the patient care work that I want to do? But how much time do I spend doing paperwork and clinical notes? I read a report that said we upgraded everybody's EHRs. We could reduce clinician time spent doing paperwork by up to 30%. Think of how many more clients. If we have better EHR systems, but I kind of digress there. So right now, the language that you have is going into a bill draft in Ohio. I started out with 6 areas that we were thinking that needed to be updated that would really inform us of our field and that we could use to work with higher ed on what are they doing with regard to recruitment and what are they doing with regard to helping that VSW person get into graduate school. What were we doing with regard to some of the supervisory hours when they have to pay for that clinical support or supervision? You know, where are we missing opportunities to connect that undergraduate person to a graduate program? And then, you know, it's great to look at a map and say, oh, well, we have 10 clinicians in Grayson County. I say that only because I thought Senator Meredith last week, we were having a conversation about it. But we don't have any VSWs or other people to support that clinician who could be doing intakes, could be doing some of those assessments that they're able to do in order to support that person. If those 8 people don't have support or 10 people don't have support, then they're probably not very satisfied. Additionally, they might not even work it. I'm telling you, they're probably not even working in Grayson County, probably driving to Jefferson County, right? Which is why we wanted to know where they're working and whether or not they're providing telehealth services. Because it's really about, you know, having somebody find the right support that they need. So this is going to a bill draft in Ohio. The 7 and 8 were recommended by the person that's been sponsored, the representative house sponsoring it. He wanted to know the number of hours they worked, and I said, we want to know how many hours are billed. And not so much how they worked. We added the supervisor question, since Ohio and Kentucky do have lessons. Indiana doesn't, but we've even had conversations around, do we have not enough? Do we have too many? Which I don't think we do, but you know, again, just really wanting to gather information about where do we hit that wall that prevents people from moving forward if they want to move forward. So I had shared this with Brenda, and she shared it with Mr. Cecil, and he asked me to bring it to you today. We have not, with KVH, Kentucky Business for Health, we have not yet found a bill sponsor in Kentucky for some of this work. The best we've gotten so far is we greeted data. There's an acknowledgement of the people that we've talked to that this would be valuable. I think it could be timely as well, since you're looking at a new software system. I got Senator Meredith to well, this is a budget year and there's 1,700 bills, but I'm happy to sit down and work on this for next session. So that's as far as we've gotten in our conversations. And that was only because I told them that this would save the state a lot of money, because we ask these questions, and nobody paid them to do it. So. So, I just wanted to share that with you, share the work that, I've started doing down here and for that, and this is just a lot of resource, we just have resources, like I said, so we can digging in deep into, where we can help support the workforce. I will say, you'll see on there, this is for all professional licensing boards, behavioral health licensing boards. What will be going forward in Ohio, maybe it's not a good thing to do that in Kentucky. Maybe it's you start with one board and then we, see if the other boards will follow, or we go to the other boards. We're sensitive to that, but it's also a great opportunity to get information and information. So, can you answer any questions?
I have a question. So, like, for instance, I don't know how this would capture me in that I have a license, but I work in a school. So is there a way that you would be able to capture, I'm not gonna be seeing people out, they can't make appointments with me. I only serve people in my school. And so I know that there are a lot of licensed social workers that work in schools. And then that would not really, we wouldn't be contributing to the workforce outside of our building. Same thing could be maybe considered for hospitals as well.
That might go under specialty.
I was gonna say, we could,
Yeah.
yeah, I would see that under specialty, but, not knowing what your software looks like. Whether it would be a fill it in or a drop down menu.
Software that our board uses to capture.
Yeah, or the new software. That might have to be a fill in or a drop down.
Because if you put a bunch of licensed social workers work in school, then how many there are, it doesn't, we don't really count. Because that's
Right.
not,
That's a good point.
That's typically the true for most social workers, because small practice of social workers, private practice. Or in hospital, or you work in substance use facility, most of them are not seeing patients outside of their agency.
I would also see you captured in that non-clinical services area, so, we have a lot of people,
we have people that aren't do clinical work.
who work for insurance companies.
No.
No, I mean, we have a lot of people that, work for insurance companies in the, greater Cincinnati service area. And we, figure we have to put them under the contract. I think only the, CCB and she is private counseling. Some of those, I think, hospitals. Will probably be, I think, more clear. When we look at some of that information.
And then there's some people that do some private practice stuff in addition to working their job. So somehow you have to make sure you capture that as well.
The other challenge, and that might be how you work with that with schools, is that we have so many conventions for bachelor social workers, so few of our BSW clients. They don't ever come through here. Because they work at the state, or they do other kind of jobs that are exempt.
I don't know. So we talked about that, and I think that Kentucky has more exemptions than everybody else. We didn't see it as a real problem in the other two states. The data that is reported through that Deloitte shared is Department of Labor data that's reported quarterly. We might have to look at just adding those that are reported already. As some kind of drop. You know what, we just may not be able to capture them beyond the BSW. Yeah, I mean, or not all of them, or very few of them. We just might not be able to capture them. I think that the reporting that. That would have to be,
Big size here.
Yes,
We have
guys.
so many people that are doing essentially the job of the BSW who don't have the BSW. And we had that conversation at times about, well, what does it mean to be a social worker? And we have a lot of people in Kentucky who are practicing social work without a social worker. We're licensed.
I think the number of folks going to graduate school has drastically increased in the last decade because of reimbursement, which is much higher than it ever was. 10, 12 years ago, before Medicaid, also should not billable, people did make significantly higher amount of money. This year, that's changed. So I think more and more people are now. That's why I don't see too many BSW out there at all. Very few BSW or anyone I see there actually active in school. Very few.
Working for the state, it looked like when I looked at the report, very good. Most of them.
Yeah, even they are now going back to school, get their complimentary basically. Most of them are, and going back to the private sector after they do their time. But as she said, the data would not reflect accuracy. They're not under our jurisdiction per se, or even a bit.
You could get graduation, right? Or, number from your higher ed to be a certain program. And that would give you something to get an idea of how many are graduating.
We don't know who leaves the state.
That's right, or what they do, but it would be a place to start to at least compare trends.
And nobody knows that.
Yeah, it'll be a very, a lot of people may switch major and go to something else.
That's what we think happens. We've been trying to figure out how we can leverage this with higher ed. Because we'd like to know who enters the program at the undergraduate level and who doesn't graduate, who exits before graduation. And then we want to be able to look at that lifetime between graduation to going on to get their master's, to get their license. Because when we talked about, and a lot of states just want to go, scholarship programs or, different things to keep them in. There's a ton of scholarship money out there, but there's not a lot of money to help them if they need to pay for their hours or the supervision, to help them pay for the exam, to help them with that period in between there. And we think that we might lose a lot of people in that gap. Just because of the costs associated with finally getting to that licensing place. We're hoping that by starting to gather this data, sitting down with higher ed, we can start to identify some of those gaps and challenges. We also think it's an opportunity to start talking about diversity workforce in the profession. Ohio, right now, it's their third installment of a 4-part look at racial equity and diversity in the behavioral health professions. And we're funded for that project. So obviously we agree that we need to be diverse. But then diversity plus the fact that we try to need more, right? It's a fine line. But again, it's the right people in the right place. We also need support that consumers should have choices. And right now our consumers don't really have choices. If we don't jive well, I'm probably gonna stick with you because you're probably the 10th person I called to get to because of network advocacy challenges.
We're providing insurance.
It's not taking insurance,
Like something, same little down.
yeah, But until we know who's out there serving who, I think it's hard to really decide how to move forward with intentionality. So, good questions. You're very pensive. You got questions.
Yes, just a comment, on behalf of the board as board counsel, this is a policy issue for the board, not really a legal issue. But in my opinion, I think if the General Assembly is gonna mandate that boards do this, and it's gonna be extra time and effort to do so and implement this, that they should do it for all of the health professions Because why is dentistry or physical therapy in less need of this kind of demographic data than anyone else? Also, the behavioral health workforce regards the quantity of healthcare that is available and not the quality of healthcare, because quality is what the board is doing by implementing the minimum standards. So I've always given the example, if one person got their college degree, went to get their MSW, marched across the stage and got their graduate degree, applied to be a CSW, got their training hours of supervised clinical practice, passed the test, and became an LCSW, the board would have done its job by issuing them a license. Then they renew in 3 years with their continuing education. They don't get a complaint that they killed a patient, and they renew their license in good standing. The board would have done its job to protect the public by licensing and credentialing that one person. But whether that one person is enough to satisfy the mental health needs of social work in the Commonwealth of Kentucky is not a part of the concern of the board. You all deal with individuals on a person by person, individual by individual basis. And the liability that I see, because it's already been done in other areas, in my experience, is that some of these things you collect, I'm afraid will be used against you. Because if you get a complaint matter and someone says, well, you're going after me because you're trying to get rid of all the part-time people, I'm only practicing 20 hours a week, and you know that. That could be used against the board in some way, that it's not fair reason. Then you have to prove that it's not. So I think you focus on quality of healthcare, not quantity. And I just wouldn't want anything that you would have to collect to be more work or possibly to be used against you. But if the General Assembly says everybody's got to do it, then everybody's got to do it.
That seems like a reasonable thing, that I don't think we would object to having that information. I don't know.
So right now in Kentucky, the nursing board, and that lady might be able to speak to it, does capture a lot of this similar information. They certainly have the most robust application. Because we're focused on behavioral health, we think it would be great if the other health professions followed suit. But to take on the medical community, we didn't even include psychiatrists or psychiatrists. We think could be a disadvantage to try to focus on. So we would not support that, but our focus is on the behavioral health field and capturing that and making this information. An example I say is, what if I wanted to go back? What if I was somebody that just got my master's, newly licensed, wanting to think about job opportunities where I could go, to be able to go to the website and go, oh, well, there are like 50 in Jefferson County, but only 1 in Pendleton County. And I go and I look, I'm like, oh, they're hiring there. That's an opportunity also to do some job seeking as well.
Now, I would respectfully assert that all of this information is available to you for free if you ask for it. Because we just talked about how we have 80% of the licensees have email address. You can send a survey to all of these people by email and have them respond. And that leaves well, why should the board be in the business of making them respond? If someone chooses not to fill this out, are you going to deny their application? Or are you going to deny their renewal because it's not complete? I think you can get all this information voluntarily and for free, because we have the addresses of all social workers. You can mail them a survey or you can email them a survey and get all of these questions and more that really are not the business of the licensure board.
How would you keep that current?
You'd have to send it every 3 years. This board only captures data every 3 years. And some boards is every year. Psychology is every 3 years. Nursing is every year. They used to be every 2 years, but they didn't like the roller coaster up and down of the cash flow. So they actually reverted back, and now they make nurses renew every single year in October. So
but our portal is designed that when people do change employment, you can update information, right? We update, I actually personally
And
do.
you have to, because
To change address, to check, yes,
Yeah,
correct.
you just say, not every 2 years, every 3 years at least,
Correct.
at the minimum, right? But there's a way for people to update their phone number, address, place of employment and such. But it's not mandatory unless you're in supervision.
Change your address.
well,
If you're in supervision, you have to have a contract. So, but if you're licensed, imaging, depending on license and practicing, it's up to the person to make that correction. Correct?
Correct. If it's a contract, it's not, when I go scan it in, then I change all that information at the bottom, because it's their new employer, make sure their address is correct and all that's updated. But otherwise, they can go to the self-service portal and change that information
Yeah.
themselves.
So you get correct in address, email.
Exactly.
It must be right.
I do think it's important information, and I do think that it could impact, understand your point, that we wouldn't want it to be weaponized against our board. One way I could see it coming into play is we have question marks about what is our workforce, how robust is it? One issue that does relate to quality that we keep coming up against are people who are not not clinically trained nor licensed, who are practicing essentially as if they are clinicians, are being sort of, maybe their employer does not say they're clinicians, but they certainly don't correct it. If people in the school system often will say, well, that's my therapist, when it's, it's a third party, entity that has gone, and that's a big way it happens in the school system, and it's a bachelor's level practitioner of some flavor, maybe a social worker, maybe not. And they either represent themselves as a therapist or other people do, and that does not get corrected, and that's a big concern. A lot of the clinicians have about, the schools in particular are saying, we want mental health care, well, that's great, you need to have mental health providers, not bachelor's level practitioners who have an enthusiasm for mental health, but are not trained, saying they're therapists. So that does get into law, and if we had solid numbers from somewhere, it may not be us collecting it, but I think that could benefit us to say we really don't have enough to serve the need, or we have more than enough, and, maybe we go from there, so. Do you think, I don't know if around the cities that's much of an issue, that's a very big problem in the rural areas where we are, it's a very big problem. We don't have master's trained clinicians out in our very, because I'm in far western Kentucky. And we don't have enough people, and so they hire newly graduated BSWs or other people and put them as something that they go around saying the therapists, or the other school personnel call them therapists.
Have you all seen you all saw the report that Deloitte from the state for the social. So I have my copy. Right, to you. Most of this data is already reported to the Department of Labor. It's just, the capacity of the department. Now, the number of hours per week is not in there, and obviously if you're, it's not in there. But your age, race, your ethnicity, some of those basic demographics are reported to the Department of Labor on a quarterly basis, except for the VA. They don't have to report that information, and if you're a private practice, that information is not being captured by the department. And it's reported to Medicaid, it's in the test data, consumers information as well. A lot of that basic demographic information is being reported. So we, kind of to your point, we're intentional in, we're not asking for something unique necessarily. We're just asking that it be put together in a way that could be potentially useful for research, useful in, not being responsible for the workforce, but be an important part of ensuring who's working in the workforce. If that makes sense. wanted to share. And you'll have to let me know or have, Mr. Cecil let me know if you want to have our research come in and go through that data. That's a way.
Okay.
We also have another piece of data, and I saw that you looked at it as well. And this is updated weekly, job postings. And where those job postings. Obviously. Are at the top of those job openings. So we can do that if you're open to that. Connect you with somebody at the council of state. Legislatures. We have. Thank you.
All right, do we have any other new business? Do we have any announcements? Have anything to share or? Okay, thank you for being with us. So, our next meeting is scheduled for Monday, February 12th, here at our board office at 11:30. So I will entertain a motion to adjourn. I do a second, all in favor? Aye. Thank you.
All right, let me see if I can figure out how to end all this stuff.